This is Sara Wartman from Bayfield County Health Department, the weekly COVID-19 update. Today we have seen the number of active cases in Bayfield County decrease from 5 to 2, and our number of cases being monitored has dropped from about 120 to 91. But this doesn't mean that we're free and clear from risk of exposure to COVID-19. According to the Wisconsin Department of Health Services website, updated weekly on Wednesdays, Bayfield County is still at high COVID-19 activity level. The majority of new cases that we see in Bayfield County are from people who have traveled out of the area and are returning, or are visiting the area and it's being spread to family members or close friends that they're staying with. However, we also know that community-to-community transmission is occurring and that you can get COVID-19 just from normal travel in Bayfield County. This reinforces the importance of wearing a face mask when going out into public places and where you'll be in closer proximity to other people. Bayfield County may not have as many positive cases as other parts of Wisconsin or the United States, but we aren't exempt from this and we cannot let our guard down. Unfortunately, the United States has the most positive COVID-19 cases in the world, and with well over 4 million cases, this will not go away overnight. We need to be vigilant and intelligent in our smaller communities, and we need to be thoughtful about our choices for our daily routines, with the places that we go, the people we visit every day, at our places of work, with our extended families, and so on. The COVID-19 world pandemic is an ongoing, ever-evolving, changing situation. Right now, we continue to look at our long-term response plans for the community. We have had a lot of inquiries from community members about our plans for public health orders and county ordinances, and we hope that our long-term COVID-19 plan helps address these questions and inquiries and provides a framework for when our local situation indicates the need for increased community prevention strategies, for businesses to consider whether or not to roll backwards or forwards regarding their level of services, and when public health orders are indicated for community health and safety. This plan will provide information to the public on their level of risk and the next steps recommended for individuals, families, communities, businesses, schools, and so on. Here are a few items that I think would be useful for Bayfield County residents to know. The vaccine isn't going to be here for a while. Our latest update shows perhaps December or January at the soonest. In the meantime, we need to make less risky choices and change our lives a bit in order to slow the spread of COVID-19 and hopefully help save lives. Masks. It's going to be the new cultural norm. I know we're Americans and we are a little bit harder to adapt and change, but this isn't going away anytime soon. We need to adapt. Masks are going to be the new cultural norm. Communities across Bayfield County value the importance of wearing face masks in public. Over the past few weeks, I've had numerous emails, phone calls, concerned community group members, citizens, and I wanted to let you know that there are many Bayfield County communities who value face masks in public. Quilting groups, sewing groups, women's clubs, church groups, all of these are busily sewing away to make masks to distribute to community members. Your community wants you to wear a mask. While we see many of the newest cases of COVID-19 as being imported from people from other communities outside of Bayfield County, that's not always the case. We have cases that have spread from one Bayfield County resident to the next. And how do we expect our visitors to Bayfield County to wear masks and not our locals? We all need to be wearing masks, and we as locals need to be role models for the behaviors that we are expecting from others. There are 3 things that can turn the tide on this COVID-19 pandemic while waiting for a vaccine. Face masks in public settings when you can't socially distance, hand washing frequently and cleaning commonly touched surfaces, and social distancing, limiting unnecessary trips, canceling unnecessary parties and events, and not visiting a large network of friends and relatives. We need to reduce our number of interactions among our friends and family in order to curb the spread of this illness. Furthermore, we need to avoid unnecessary large gatherings. If a large gathering still occurs, like a wedding or a funeral, then the 3 steps previously mentioned, the face masks, social distancing, and washing your hands, need to be adhered to or followed to prevent the potential spread of illness during this COVID-19 global pandemic. While it pains me to say it, we need to cancel non-essential large gatherings for the next foreseeable future. We know many people can be spreading this virus with very mild or no symptoms. We also know that other people require hospitalization and medical care, including the use of plasma and pharmaceutical intervention. Treatment is getting better, but we need to be cautious that we don't have too many residents sick all at the same time so that we do not overwhelm our healthcare and public health systems. I know that Bayfield County is a strong, resilient community. We're tough, and I know we'll get through this. Stay healthy and strong in Bayfield County. Have a good weekend.